Hello and welcome back to the Strategic Health Check. I'm your host, Jose Gaign. Over the past two episodes, we've been looking inwards. We've examined the fundamentals of our fundraising strategy and the critical importance of retaining our precious donors. Today, in our final episode of this New Year's Day launch series, we're going to lift our heads up and look outwards. We're going to take a comprehensive strategic health check on the entire UK charity sector. Because none of us operate in a vacuum, we are all part of a complex, dynamic, and often turbulent ecosystem. And the charities that succeed in the long run are the ones that don't just react to the weather, but learn to read the forecast. Today, we're going to look at the storm clouds on the horizon, but we're also going to identify the silver linings. We'll explore the big, scary trends, from AI to mergers to burnout, and reframe them not as threats to be feared, but as opportunities to be seized. This is all about future proofing your charity. And I'm going to be completely honest with you today. This is a longer episode than the previous two because this topic deserves the time and space. We're going to go deep. We're going to explore not just what's happening, but why it matters and what you can do about it. So grab a cup of tea or coffee, settle in, and let's take this journey together. Let's be honest, it feels like a tough time to be leading a charity in the UK. It's not your imagination. We are facing a perfect storm of economic, social, and political pressures that are squeezing small to mid-sized charities from all sides. First, there's the relentless economic pressure. We talked last week about the cost of living crisis, and its impact is profound. A recent report from the NCVO shows that 1 in 5 charities say they are struggling to survive financially. Public donations are down, while at the same time, the demand for our services is soaring. For health charities, this is particularly acute. People's physical and mental health is suffering under the strain of financial anxiety, and they are turning to us for support in ever increasing numbers. We are being asked to do more with less. It's a simple, brutal equation. Now, let me give you a concrete example. I worked with a small charity that provides support for families affected by rare genetic conditions. In 2019, just before the pandemic, they were supporting about 150 families a year. By 2024, that number had jumped to over 400 families. Their demand had nearly tripled, but their income, it had stayed completely flat. They were trying to stretch the same resources to serve 3 times as many people. The chief executive told me she felt like she was performing triage every single day, deciding which families got support and which had to wait. That's not a sustainable way to run a charity. That's a crisis. Second, there's the crisis of trust. Public trust in charities has been eroding for years, hit by a series of scandals and a more cynical media landscape. According to the Charity Commission, public trust and confidence in charities is at its lowest level since they started tracking it. This matters. It makes people hesitate before they donate. It makes them question where their money is really going. It means we have to work twice as hard to prove our credibility and our impact. The days of being trusted just because we have quote unquote charity in our name are long gone. Third, there's the political turbulence. With the general election seemingly always on the horizon and shifting government priorities, long-term planning has become incredibly difficult. Policies can change overnight, and funding streams that you have relied on for years can vanish with the stroke of a minister's pen. This creates a huge amount of uncertainty and makes it very difficult to commit to long-term projects or staff. I've seen charities that have had to make redundancies not because they weren't doing good work, but because a government funding program was suddenly cut with just 3 months' notice. It's devastating. Fourth, there's the regulatory burden. Don't get me wrong, I believe in accountability and transparency, but the administrative load on small charities has become immense. The Charity Commission, the fundraising regulator, GDPR, safeguarding requirements, health and safety compliance, the list goes on. For a large charity with a dedicated compliance team, this is manageable. But for a small charity where the CEO is also the head of fundraising, the finance manager, and the HR department, it's absolutely crushing. I've worked with charity leaders who spend 30% of their time just on compliance and reporting. That's 30% of their time that they're not spending on delivering services or raising money. And fifth, there's the human cost of all this pressure, the epidemic of burnout in the nonprofit sector. Charity leaders and fundraisers are some of the most passionate, resilient people I know, but they're not superhuman. The weight of responsibility, the constant financial anxiety, the emotional toll of dealing with trauma and illness day in, day out, it all adds up. A recent study found that 79% of charity workers have experienced burnout in their careers. When your team is exhausted, they cannot be creative. They cannot be strategic. They are in survival mode, and a charity in survival mode cannot thrive. I saw this with a client I worked with last year. They provide mental health support for young people, an incredibly vital service. The CEO was a true hero, but she was on her knees. She was dealing with a 50% increase in demand, a major grant that hadn't been renewed, and two of her best fundraisers off on long-term sick leave with stress. She was trying to be a service manager, a fundraiser, and a counselor to her own team all at once. The organization was caught in the perfect storm, and it was close to breaking point. This is the reality and it can feel overwhelming. But I'm not here to spread doom and gloom. I'm here to tell you that within every one of these challenges, there is an opportunity. The future belongs to the leaders who can find it. So now, let's turn our attention to something positive. Let's be optimistic. The silver linings. Let's turn threats into opportunities. So, how do we do that? How do we turn these big, scary trends into strategic advantages? Let's look at 5 of the biggest shifts happening in our world and reframe them. I'm going to spend real time on each of these because they are that important. Opportunity number 1, the rise of artificial intelligence. For many small charities, AI feels like another threat. It's something for big, huge budgets and corporations with those budgets. But I believe it is the single greatest opportunities for small charities to level the playing field. You don't need a data scientist to use AI anymore. You just need a chat GPT subscription and a bit of creativity. Think about it. You can use AI to write a first draft of a grant application in 20 minutes, a task that used to take days not too long ago. You can use AI to analyze your donor data and identify your top prospects for a major gift appeal. You can use it to brainstorm a dozen different subject lines for a fundraising email and see which one is most effective. You can use AI to create a personalized thank you letter that references a donor's specific interests. These are things that used to require a huge amount of time and resources, and now they are available to you instantly. Let me give you a real example. I worked with a health charity that had a database of 5,000 donors, but they had never properly segmented it. They were sending the same generic newsletter to everyone. We used AI to analyze the data and identify distinct donor personas. We found that they had a group of about 200 donors who were all healthcare professionals. We created a specific communication stream for this group with content about the clinical research the charity was funding. The engagement rate for this group went up by a staggering 300%. Their average gift size doubled. That's the power of AI driven personalization. At Gain Strategic, we are already working with our clients to build AI powered workflows that are saving them hundreds of hours and making their fundraising smarter and more effective. This isn't about replacing fundraisers. I'd be out of a job. It's about giving them superpowers. It's about freeing them from the tedious, repetitive tasks so they can focus on what humans do best: building relationships, telling stories, and inspiring action. Opportunity number 2, the collaboration imperative. The headline is often negative: charities forced to merge to survive. But what if we reframed it as the collaboration imperative? In a world of scarce resources, trying to do everything on your own is no longer a viable strategy. The future is networked. The future is collaborative. This doesn't have to mean a full legal merger. It can start small. Could you partner with another local health charity to make a joint application for a large grant that neither of you could win alone? Could you share a back office function like finance or HR to save costs? Could you run a joint awareness campaign to reach a wider audience? I worked with two small cancer charities in the same town. One was brilliant at providing counseling and emotional support. The other was fantastic at practical support, like transport to hospital appointments. For years, they saw each other as competitors. And Gain Strategic brought them together and helped them design a joint service, a single holistic package of support for local cancer patients. They co-wrote a grant application to a major trust and won a significant multi-year grant of £250,000. They achieved more together than they ever could apart. But collaboration doesn't just have to be with other charities. What about collaborating with local businesses, with universities, with faith groups? I know a small mental health charity that partnered with a local gym chain. The gym provided free memberships to the charity service users as part of their recovery program. The charity provided mental health awareness training to the gym staff. It was a win-win. The charity got a valuable service for its clients at no cost, and the gym got positive PR and a more skilled, compassionate workforce. Who could you be collaborating with? The answer is probably more people than you think. Opportunity number 3, the NHS Partnership Revolution. For many health charities, the NHS looms as a huge, impenetrable institution. But there is a massive shift happening. The NHS is increasingly recognizing that it cannot solve the nation's health problems on its own. It is actively looking for partners in the community to help deliver services, particularly around prevention, mental health, and social support. This is the world of social prescribing. Social prescribing is a golden opportunity for you to position your charity not as a supplicant asking for grants, but as a vital expert partner that can help the NHS achieve its own objectives. Can you prove that your services reduce hospital admissions? Can you show that your support helps manage their long-term conditions more effectively at home? If you can start to move from a grant-based relationship to a commissioned service relationship. This means sustainable, contracted income that you can rely on all year round. Let me tell you about a charity I worked with that provides support for people with chronic pain. They approached their local integrated care board with a proposal. They said, "We know that people with chronic pain are frequent users of A&E and GP services. We can provide a community-based pain management program that will reduce those visits." And they had the data to back it up. They showed that their program reduced A&E visits by 40% and GP appointments by 50%. The Integrated Care Board commissioned them to deliver their service across the entire region. Their income went from $80,000 a year to £400,000 a year. They went from surviving to thriving. This is about moving from the kids' table to a seat at the main table as an indispensable part of the local health economy. But it requires a shift in mindset. You have to start thinking like a business, not just a charity. You have to be able to articulate your value proposition in the language that the NHS understands: outcomes, cost effectiveness, and impact. Opportunity number 4, the digital transformation. The pandemic forced every charity to go digital, whether they were ready or not. And while it was painful at the time, it has opened up incredible opportunities. Digital fundraising is no longer a nice to have, it's a must have. And the charities that have embraced it are seeing remarkable results. Think about the possibilities. You can run a virtual fundraising event that reaches people all over the country, not just your local area. You can create an online community for your service users that provides support 24/7. You can use social media to tell your story to millions of people at almost no cost. You can accept donations via text message, Apple Pay, or cryptocurrency. I worked with a small charity that had always relied on a single annual gala dinner to raise the bulk of their funds. It was a lot of work, a lot of stress, and it only reached about 200 people. Gain Strategic helped them pivot to a hybrid model. Don't get me wrong, they kept the gala, but they also launched a monthly online giving campaign with powerful video storytelling. Within a year, their online giving had overtaken their gala income, and it was far more sustainable, far less stressful, and far more scalable. Opportunity number 5, the generational wealth transfer. Here's a trend that doesn't get talked about enough. Over the next 20 years, there is going to be the largest intergenerational wealth transfer in human history. The baby boomer generation, which controls the vast majority of the UK's wealth, is going to pass that wealth on to the next generation. And a significant portion of that wealth is going to go to charity through legacy giving. This is a massive opportunity, but it requires you to start having conversations about legacy giving now. And I know it's an uncomfortable topic. Nobody wants to talk about death, but the research shows that 40% of people would consider leaving a gift to charity in their will, but only 6% actually do. Why? Because nobody asked them. You need to start normalizing these conversations. You need to create a legacy giving program. You need to tell the stories of people who have left gifts in their wills and the incredible impact those gifts have had. This is long-term thinking. The donors you cultivate today might not leave you a gift for 20 or 30 years, but when they do, it could transform your charity forever. Now, let's talk about building a resilient, future-fit charity. What does that mean? It means that the charities that will thrive in the next decade will look very different from the charities of the past. They will be leaner, smarter, and more collaborative. They will be what the author Nassim Taleb calls anti-fragile. An anti-fragile organization isn't just resilient. It doesn't just withstand shocks. It actually gets stronger from them. It uses the pressure and the chaos to learn, adapt, and evolve. An anti-fragile charity is one that sees the rise of AI and immediately starts experimenting with it. It's one that sees the funding squeeze and immediately starts building partnerships. It's one that sees the pressure on the NHS and immediately positions itself as a solution. And the foundation of an anti-fragile organization is its culture. It's a culture of curiosity, not fear. A culture of collaboration, not competition. A culture that empowers its people, protects them from burnout, and gives them the psychological safety to experiment and innovate. Let me tell you what this looks like in practice. I worked with a charity that was struggling. Their team was exhausted, their income was flat, and morale was at rock bottom. We started by addressing the culture. We introduced a policy of protected time, one afternoon a week where staff were not allowed to answer emails or attend meetings. They could use that time to learn, to think strategically, or to work on a passion project related to the charity's mission. At first, the CEO was skeptical. She thought, we don't have time for this. We're barely keeping our heads above water. But within 3 months, the impact was remarkable. Staff started coming up with creative new fundraising ideas. They started collaborating across departments in ways they never had before. One staff member used her protected time to learn about AI and built a chatbot for the charity's website that answered common donor questions. It saved the team hours of work every week. The charity's income started to grow, not because they were working harder, but because they were working smarter. They were innovating. They were thinking long term. They had moved from survival mode to growth mode. This is the ultimate goal of our done with you approach at Gaign Strategic. We don't just want to help you write a better grant application. We want to help you build the systems, the strategies, and the culture to become a resilient, future fit, anti fragile organization. We want to help you turn the storm into a tailwind. And that brings us to our final piece of strategic homework for this New Year's Day launch series. And it's a big one. Your homework is to conduct a future fit SWOT analysis for your charity. I want you to take the 5 big opportunities we've discussed today: AI, collaboration, NHS partnerships, digital transformation, and legacy giving, and think about them in the context of your own organization. For each one, I want you to ask 4 questions. 1, what are our existing strengths that could help us seize this opportunity? 2, what are our internal weaknesses that might hold us back? 3, what is the single biggest, most exciting opportunity for us in this area? And 4, what is the biggest external threat if we fail to engage with this trend? This is a powerful strategic exercise, and you will enjoy it if you put effort into it. It will help you move from feeling overwhelmed by the future to feeling empowered to shape it. It will give you a clear-eyed view of where you are strong and where you need to develop. And it will give you a roadmap for the next 12 months. That SWOT analysis is a fantastic starting point. But to help you go deeper, I've created a brand new exclusive resource for our listeners. It's called the Future Fit Charities Scorecard. It's a comprehensive tool that allows you to benchmark your organization against the key characteristics of a resilient, future fit charity. It will give you a clear score and a personalized action plan. You can download it for free right now at gainstrategic.co.uk/podcast. And if you complete that scorecard and you feel a little daunted by the journey ahead, please don't be. Book a free, no obligation discovery call with me. Let's talk through your results and explore how the Gain Strategic Done With You approach can provide the expert support and the extra pair of hands you need to build a truly anti-fragile organization. You can book that free call at gainstrategic.co.uk/discovery. Thank you so much for joining me for these first 3 episodes to start the new year strong of the Strategic Health Check. We've covered the fundamentals, we've dived deep into retention, and we've scanned the horizon for the future. My hope is that you are leaving with not just new ideas, but with a renewed sense of energy, optimism, and control. The future of our sector is not something that happens to us. It is something we create together. Subscribe to the Strategic Health Check podcast so you don't miss anything, especially our next episode coming in 2 weeks. We're going to be bringing you interviews with sector leaders, deep dives into specific fundraising strategies, and practical, actionable advice that you can use immediately. Now, let's go out there together and build a future of health. I'll see you very soon.